Let's hit it.
Hi everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori La Bey, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about.
Hi everyone, and welcome back to Alzheimer Speaks Radio. I'm your host, Lori La Bey, and if you enjoyed our opening music, it's called Clarion Call by the Mark Arneson Band, featuring My Adore, and you can download that on any of your favorite music platforms. Now, before I get going here, I want to just thank you as our listeners for all your likes, your clicks, your shares. Your loyalty has been spectacular, and it's really helped us push out basically the world's information and conversations at all different levels that we have here on Alzheimer Speaks Radio. So again, I just want you to know how much I appreciate your loyalty and your kindness towards us and being part of our community, because I really truly believe that collaboration and community is the way that we are going to get rid of dementia the way we see it today, and we're going to build a much better life for everyone who is touched by it. I also want to give a shout out to Music First and Choral Faith. They are offering a COVID special right now where it's free and you can download Music First and Choral Health. Just go to choralhealth.com /COVID-19. And we'll be talking actually with the Memory Cafe Directory founder. So let's get to our panelists. I'm going to have each of them introduce themselves. Well, I'm excited to have our guests introduce themselves to you today. I just think they can do a much better job than I can. So Lisa, if you wouldn't mind introducing yourself, saying your full name and your company, and just give us a little taste of what you do, and then we'll dive a little bit deeper later.
Okay, my name's Lisa Tyburski. I'm the Chief Marketing Officer at the George G. Glenner Alzheimer's Family Centers in San Diego. We run 3 specialized adult day centers specifically for people with Alzheimer's and other forms of dementia. We run support groups, memory cafes, professional education program, and a brand new telehealth virtual dementia care program that I'll tell you a little bit about later.
Wonderful, thank you. And Maria, how about you?
My name's Maria O'Reilly. I'm an academic. I work in Bundaberg in Australia, and I've worked clinically and in the research field with dementia for many years. And at the moment I have an interest in people with dementia in the community, but I've also worked in residential care.
Wonderful, thank you. And Dave, how about you?
My name is Dave Wiederrich, and I operate the Memory Cafe Directory, which is a global directory of memory cafes around the world.
Dave, since I have you live with us, why don't you go ahead and talk about how you've had to adjust, if at all, with the Memory Cafe Directory and what you're hearing from the general public.
Yeah, there's been quite a bit of change on Memory Cafe Directory. Pre-COVID, we had been growing dramatically. There's about 900 listings in now 5 countries, if you count a fresh Brazilian one in the virtual side. But what's happened is people are basically not meeting in person, and everything just ground to a halt. When I noticed that was really the case, what value are memory cafes if you can't attend? There was starting to be some movement toward putting those online. The Zoom platform is certainly the most popular. It's the easiest to use and really good quality. So I created a section on the directory called Cafe Connect. And what that is a listing of the virtual memory cafes. If you think about the differences between a traditional memory cafe, it's It's geography based. It takes place in a state, in a city. And so that's how the memorycafedirectory.com is organized. Well, when that changed, virtual memory cafes, there isn't the geographic boundaries. So the Cafe Connect page is, there's close to 30 on there now, and I've got a few more to add, but it's getting a little cumbersome in that many are every Monday, second Tuesday, second and third Wednesday, and it's starting to be quite a juggling match. So a little preview, starting June 1st, I'm working on this now behind the scenes, but starting June 1st, there will be more of a traditional calendar view for all of these, so that you can see a month at a glance, a week at a glance, or even the day, the schedule for the day. And that will be live June 1st, and much easier to accommodate, fortunately, a growing population of virtual memory cafes.
I love that idea of having the calendar, because it is scrolling down. It is confusing trying to note, and for people just to be able to look. Because I know for our memory cafe, we're virtual, but we really, I think I've only had one person pop in to come and visit. And I think part of it is there's just a lot to take in. So I think the calendar setting will help with that.
And the long listing, the list of entries on a page was fine when there was 6 or 8 or 10, and now there's well over 25 and close to 30. It's getting a little onerous. So that will be a much easier way for people to find it. And I'm encouraged for the future, because quickly that page became the most often visited page on the entire website, even more than the homepage. So people are searching for virtual memory cafes. They're finding Cafe Connect, and they're starting to get engaged. Hopefully that'll continue to grow.
Oh, that's fantastic. I know for so many people, because I do a lot of these Zoom sessions, they're very nervous about, can I do this? And then once they're stepped through, they're like, oh my gosh. I mean, it just opens up this whole other world for them to be involved in. And building that confidence with computers is huge. I mean, I remember being fearful of, if I push a button, I'm going to lose something. And now I'm like, it's backed up.
Yeah.
It's there somewhere. I can search for it, and I mean, you just get more used to how they operate and not having to be as scared. And I think that in itself is huge. And then once people access that, they realize, wow, I can do this with the book club or my prayer club or my high school friends, or my peeps down the hall if I'm in a community living situation, whatever it might be, my family, my grandkids. And it's just it's really blossomed, and I can see and I hear from people, and I don't know if you hear this as well, but I mean, there just is this sigh of relief and like, thank God this is available to us.
Yeah. It really is something that I think will, this virtual nature of the memory cafes that we're somewhat forced to deal with now, but I think this will live on for a different reason as we go forward. I hope we can start to meet in person. I heard a stat the other day that every state, all 50 states, are in some form of reopening. Some are, of course, more loose than others, but at least that process has started, and I hope it takes place in a very safe way. So at some point, I'm very hopeful that we'll be able to get back to the regular 900 memory cafes that are listed and keep those growing. But if you think about something that really isn't part of a lot of this discussion, and that's just the overall isolation of seniors, and especially our dementia community, while 900 is great for the number of listings, not everyone in the country or the world can just drive 10 minutes and be at a comfortable location to enjoy a memory cafe. So the social isolation that actually was in place before COVID, and it's becoming a little more prevalent now, I think this will help people connect even more in the future, because if you don't have a memory cafe nearby, you might have a computer nearby that runs Zoom, and you can enjoy the company of people that are not nearby. My favorite story was some feedback I got from a memory cafe in Massachusetts, Beth Salzberg. one of her participants speaks Portuguese and was connected to the new Brazilian Memory Cafe on Zoom. And so she enjoyed a Portuguese conversation where normally it's a little difficult for her to enjoy that. So here she went from Massachusetts to Sao Paulo, Brazil, and was able to connect using Zoom. So it's something that I think will continue, hopefully long after our COVID challenges are behind us.
Oh, I agree. I see this sticking with us, and a lot of people are saying that they feel now that they're going virtual, even for conferences and educational programs, that they're reaching more people than what they were prior, and their costs are a lot less. You know, because they don't, you know, they're not farting with the hotel and the food, and you know, blocking off rooms, and just I mean, there's so many levels to pulling some of that stuff off. And yet others are saying, well, we still want to do swag bags, and we're sending that out just as a reminder for people that, you know, this event is taking place. So everything is really changing. I think the creativity is going to be absolutely wonderful, and it'll be interesting when we measure out the support and the services serving people with dementia, and how it impacts some other things that maybe we do less of in terms of travel and airports and hotels and things like that for some of the things that take place. I know in Minnesota here, we're up now to we can meet and gather in groups of 10, but I don't think our group is ready to get back together. I think they kind of want to wait because, you know, we've got a lot of people in vulnerable situations. Let's wait and see if it's going to spike. Let's not be one of those that spikes, you know, themselves personally. So kind of taking that wait and see approach. But I think everyone will be a little bit different on that. Dave, I think I forgot to ask you first off if you've been personally touched by dementia or by COVID.
Well, fortunately, not by COVID-19. That's we're very grateful on that. But I do have a very dear friend who has a mother who, through the support of the family, is fighting hard to stay independent, and so far so good with her. But I did lose an older cousin, more like an aunt, last year to dementia. So tough situation.
Yeah, people are really, really struggling these days. Lisa, I'm going to go to you next, and would just first like to ask you if you've been personally touched by dementia and or COVID.
Luckily, COVID, no. And locally, we haven't had a lot of cases here in the town that I live in. Alzheimer's, yes, unfortunately, very, very much so. My mother had Alzheimer's, and her sister as well. Her sister got it first. She was younger. She was diagnosed at age 55, and she had it for about 10 years, died at 65, and she had every ugly symptom, let's put it that way. She had a really, really tough time. My mother passed away at age 71, so she had it in her 60s. And it was, it wasn't good. Luckily, she was always very sweet her whole entire life, and she stayed sweet. A lot of people's, behavior changes, of course. And my aunt, her behavior did change, and she got combative and had all of those issues. It was really tough on my uncle and my mom, because my mom was still aware enough to understand that she had it, or aware enough to know that her sister had it. And so we didn't want to tell her that we thought she was having it. It was really, really tough time. And that's actually why I work at the GLENNERCARE centers. I was a stay-at-home mom at the time when my mom had Alzheimer's. And when I wanted to go back to work when the kids got older, I thought I want to do something in this field. I didn't really know what. I just wanted to, whether it be volunteer or a paid job, whatever, I just wanted to get into the space because I just saw how hard it was. We didn't know that before. I mean, we were the typical, I think, family caregiver. That's just, you don't have those caregiving skills, right? Why would you, if you've never been through it before? So gosh, if only I knew then what I know now, but anyway, so yes, in a long-winded answer to your question, we were very, very much touched by it. And now, of course, I have many friends whose parents have it and or spouses, and are always, turning to me or to my organization for help. But COVID, no.
Why don't you tell us, dive a little bit deeper into the GLENNERCARE organization and what you provide, and how it's changed since the pandemic?
So yeah, I'll give you a background. We are a nonprofit organization founded here in San Diego, as I said earlier. And I do want to sort of point out why we were founded in the first place, because it speaks to what a lot of family caregivers are going through. So we were founded by Dr. George Glenner and his wife, Joy Glenner. Dr. Glenner was a physician and researcher at the University of California in San Diego. And he was focused on Alzheimer's research, but he was also a treating physician. So one night, or treating patients, I should say. And one night in the middle of the night, he and his wife received a phone call from the husband of one of his Alzheimer's patients. And the man had a loaded gun, and his solution to the stress that he was going through was to murder his wife and commit suicide. I mean, he was at his wit's end, obviously. So the Glenners were able to get the call traced. They were able to stop that murder-suicide from happening. But the next day they said, we've got to do something for these families now. We've got to, focus on research, of course, it's vital, but these caregivers are struggling right now. So they opened up our very first center. It's a little cottage. We still have it today. It's just in a little house kind of just outside of downtown San Diego. It's only licensed for 24 people. And since then, that was in 1982. And since then, we've grown to 3 centers. So now we have three nonprofit adult day centers specifically for people with dementia. And about 2 years ago, we created a new center we call it Town Square. It's the same, it's an adult day center for people with dementia, but it focuses all on reminiscence therapy. So we rented out a big warehouse building in Chula Vista, California, and we built out the inside to replicate or resemble, I should say, a small 1950s town. And the whole idea with that is to facilitate reminiscing. So you come in, there's a 1950s diner with turquoise booths. There's an old-fashioned pub and a barber shop. And so all the activities take place in all of these storefronts, as we call them. They're really activity rooms. But it's a lot of fun. It's a lot of fun. We play old music and have entertainers come in, play old songs, old games. We have old checkers and puzzles, and just it's great. Pictures of the presidents from the time, on the wall. So it's a lot of fun. So that's actually the future of the Glenner Center as far as our daycare centers. We want to replace our other 2 with Town Square similar day centers. We also franchised it. We partnered with a for-profit agency that's franchising the concept across the country. So you'll soon see other Town Square day centers pop up all over the country. So we also, in addition to our day centers, which is our core business, we do caregiver support groups for specifically for caregivers of loved ones with dementia. We do have memory cafes. Actually, we run a few memory cafes here. We've got a professional education program, so for professional caregivers of people with dementia. And then our newest program is a telehealth virtual remote, whatever buzzword you want to use. It's a remote dementia care program. We're calling it GLENNERCARE. And ironically, we started working on this about a year ago because we had so many families asking us for help and assistance outside of our operating hours. And they need resources. They need advice. They need somebody to call. So we started developing the program a year ago for a spring 2020 launch, having absolutely no idea that we would be in a situation where telehealth was going to be the new thing. So we just released it in April. And again, it's a remote dementia care service where people enroll. It's not a hotline. You enroll, you become a member. We get to know you, your situation, your background, how your disease is progressing. And then anything happens at home. You can't get your loved one in the shower. You need help with toileting. They're wanting to leave. Any behaviors, they just can call in as many times as they need for advice, recommendations, support. If we need to get their doctor on the phone, we can do that. We can do a video call with their physician. And the whole idea is really to help people with the day-to-day in and out things that just happen all the time when they're at home. And things that you don't normally go to the doctor for, right? If you can't get someone in the shower, you're not necessarily going to go to the doctor for that, right? But you still need help. And if there is a situation that you might go to the doctor or emergency room or urgent care or hospital, especially now, people are trying to avoid that. So we're trying to help them with the day-to-day challenges that they have and avoid hospitalizations. And then the other component that's really key is we have them take their blood pressure every day. They enter their blood pressure and we can flag a crisis before it happens. So we'll monitor, we'll know their normal baseline blood pressure, but we can see if there's a dip or a spike and we can say, hey, we might want to get your doctor on the phone, something's going on here. So that's kind of it in a nutshell. We have been significantly affected by COVID with our day centers. We are an essential service as an adult day healthcare center, and we stayed open for as long as we thought was reasonable. But in the beginning of April, we decided to suspend services at all of our centers. We did have a few cases with staff and participants. And so we suspended services in April. So really GLENNERCARE is pretty much our core business now. So yeah, things have changed quite a bit.
Yeah, I know here in Minnesota, most daycares aren't operating. And, we're seeing a spike in the need for family for services, just like you're talking. And so it's ironic that you had that in the pipeline.
It's crazy. I mean, it's really, I think some people think we started it because of the need that's out there now. And we really had launched it or started working on it a year ago. And I like to let people know that because that means we've been working on the infrastructure and the whole entire program for about a year. It's not something we just slapped together because of COVID. The timing is just weirdly ideal. But yeah, our people that were attending our day centers, now they're finding themselves, they're home 24/7 having to do all of the caregiving. They don't have that respite. And we're finding they're getting injured too. They're trying to lift more often, help in the bathroom or, do things that they normally didn't do. And so it's really been tough on our caregivers, really tough on our.
Now with this GLENNERCARE, you said that's a membership. Do you have to be in San Diego, or can anybody join in on that? Because it sounds like can be kind of a coaching and support and resource, a little bit of everything.
Yeah, no, it's nationwide. It's anywhere really. Certainly we know the resources here in San Diego the best, and most of our members so far are here. Actually, we have one in Florida that's about to enroll. But no, it's nationwide because it's virtual. We can help anybody anywhere, really.
Yeah, well, and sometimes you just need the main names to tell them to seek out in their own area, and people don't even know those organizations exist,
and the main names, but even like trying to get somebody in the shower, or trying to get help somebody with eating, that's doesn't have anything to do with your geographical location, so we can certainly help. The way you set a table can help somebody to eat, the color of the dishes and the contrast and all those things. Most people don't know that stuff.
Yeah.
So just something as simple can make mealtime so much easier if you just knew it.
Exactly. Exactly. I think that's wonderful. What kind of feedback are you getting from both families and staff with these changes?
For us, for our families, our families, of course, are desperately waiting for us to open. We had some people even before we closed, they said, you guys are doing social distancing. This is great. I trust you. The benefits of my husband attending the center outweigh the risk of him potentially getting COVID. That's how much they need this. And we get calls all the time. When are you opening? When are you opening? When are you opening? So yeah, that's been tough. We're offering GLENNERCARE for free to all of our families right now. I should back up. It is covered by Medicare Part B, which is awesome. For those people that are not enrolled in Medicare Part B, we're picking up the cost for our enrolled families right now as a show of support while we have suspended services. But yeah, our families can't wait for us to open back up.
Yeah, like you said, the repercussion of it is so huge. I know I've heard from people around the country thinking, people who are living in a community, they're going to pull them out. And it's like there was a placement for a reason, people, and those things haven't gone away, and most likely the disease has progressed. It hasn't lightened up, and your level of stress has already increased just being in this mode. And people say, well, I'll just hire someone. I'm like, well, good luck with that. 'Cause everybody's having a tough time hiring people right now too. So it's just a very interesting time. And not that I think people just have to look at big picture and be realistic, because there would be nothing worse than pulling somebody out of a community and at home. And then if something did happen, I think most people would have a really hard time not feeling guilty over that situation. And just even analyzing, okay, how am I going to get groceries? Now, do I have to bring them with me? Am I, what's the situation on all these things? And there's just so many details, but I do think that society at large is getting a little eye-opening in terms of what services are really doing for people, and what a difference they're making in not only their physical lives, but mental health wise as well.
The other thing is, when we do open up, and just from a business perspective, we're trying to figure out how to do that safely, right? So now as an organization, we need to put some funding into plexiglass at the receptionist. We're going to be taking people's temperatures, the markings on the floor, all of those things now that we have to do. And we've decided that when we do resume services, we're likely going to only open up at 25% capacity to maintain social distancing. Now at our town square center, that's a lot bigger. That means a bigger number. But for example, the first center I told you about, that's only licensed for 24 people. I mean, that means we can only have like seven people. So from a business perspective, and as a, smaller nonprofit, I mean, that puts us really in a tough spot, as an organization, but we want to do it safely, of course, for everybody. But that's been an issue. And then we're trying to decide, do we have people sign a COVID waiver when they come back? I mean, maybe a lot of organizations are going to be doing that. I don't know. But yeah, we've really had to switch mindset here.
Yeah, it's another liability, and the last thing you want is a lawsuit on top of all of this when you're doing the best you can do. If you open up at 25%, are you looking at the same people every day, or are you looking at rotating those numbers too? Because I can see families going, what about me? And because not everybody goes every day. But then there's that safety of, okay, now we have more things going on within a physical structure, and that makes a difference too.
Well, and that's another thing. That's a good point. We're trying to figure out scheduling, right? Because we do have some people that come 5 days a week, especially the people that come through PACE. We're contracted with a couple PACE programs here. They're all-inclusive programs for the elderly. We're an alternative care site for them. And so we have a lot of people that come every day. And you're right, it's not fair to someone who wants to come, like, what about my one day? I can't come my one day or my 2 days now, or how's it going to work? So maybe the 5 day a week people have to go down to 2 days so that we can be fair and at least give everybody a little bit of a break. That's going to be quite a scheduling challenge for that, to be fair. And I'm sure people are going to be maybe mad that they can't get a spot. I don't know. That's all the stuff we're trying to figure out. And then we'll slowly, maybe once every 2-3 weeks, a month, I don't know, maybe go up to 35% capacity, 45% capacity. We're just going to have to monitor it like crazy and see how it goes.
Any possibility of doing anything virtual with the group, or is there progressive level that's just not going to work? I'm just thinking with reminiscing and things like that.
We have thought of that. We're putting that together. I have our director of education and then the director of the programming and activities going to put something together and film it or do a Zoom call live. I don't know if it'd be filmed or live on a Zoom call, doing activities in Town Square, right? And just to kind of show what we do. I mean, it's not the same, but just to give caregivers at home activities, reminiscence therapy activities to do. So yeah, that's in the works too. Same with virtual support groups. We have 1 or 2 of our groups are already doing virtual support groups, which, like you were saying earlier, I think some of that's going to stick. And because, we have some people that can't come to support groups anyways because they can't leave their loved one at home. right? So actually we will offer free respite for people like that. If they want to come to the support group, we'll watch their loved one for free for the couple of hours. But some people don't take advantage of that, and then they can't come because they can't leave their loved one at home. But now with Zoom, they can do that.
Yeah, it's an interesting.
It's like
It
a lot going on.
to weigh it out, and then you're trying to be profitable. And I'm thinking, Dave, of you, even with your memory joggers and stuff. I don't know if you want to explain those, because that might be something both Lisa and Maria could tap into.
I'd be happy to, thanks. Memory Joggers is a free activity that I make available through Memory Cafe directory. And it's based on science. I did some research and found that I think part of the reason we like trivia so much, when we recall something from longer term memory, and obviously it comes back to us and we have it now in short-term memory, every time that recall takes place, it strengthens that connection to that memory. And what struck me was that we all have these sayings, these idioms that we all grew up with, coming out smelling like a rose, or a day late, $1 short. So what I did was start to put these together in just 20 at a time in a PDF, and I think I'm up to 13 volumes now. So there's 240 or 60 or whatever the number is. Just simple little phrases, and I've heard people use them both at home, just to engage and have some fun. Certainly in the Memory Cafe environment, it's interesting to hear how they're used in different ways. Some are depending on the group and the makeup of the group. Sometimes it's a calm, kind of quiet, start the phrase and then just wait for people to respond. In other cases, it's a lot of fun. They make it a competition, and they'll start reading the phrase, and the first person that shouts it out, wins. And it gets pretty raucous, but it all depends. You can use it any way you like. So it's been fun to get the feedback on how people are using those, and I've got plenty in the pipeline. I'm just going to keep publishing them as I have some time to pull them together and make sure I'm not duplicating and doing all that. But if you'd like to go to the Memory Joggers page on Memory Cafe directory, they're just PDFs. You can print them, download them, whatever you like to do, and have some fun with them.
Wonderful, thank you. Lisa, was there anything else that you wanted to add on what you're doing and how you're doing it?
No, I mean, I think for your listeners, certainly listeners that are not in San Diego, our daycare centers aren't going to be helpful. But to keep an eye out for other town squares across the country, because there's about 13 or so franchises that will be opening. But for GLENNERCARE, I mean, this is a real great opportunity at an extremely reasonable cost and or free if they're in Medicare, to have a care partner just at their side 24/7. I mean, they can just call anytime, like about a behavior, about any issue at any time, they can call into our team. And I think that will help peace of mind for people, stuck at home. And even when things do open up, just to have a care partner there at their fingertips. So really just to get the word out that it is available nationwide.
Okay, and can you share pricing on that? Are you comfortable with that?
Yes, of course. Yeah. So again, if you're enrolled in Medicare Part B, it's covered. If not, it's roughly $3 a day, which equates to $91.25 a month.
Okay, wonderful. Well, thank you.
Which I think is a steal.
Yeah, well, yeah.
It's a steal.
One call when you're having a bad day.
For $3, you can call 5 times a day for $3. I mean,
yeah,
it's great. And we're proud to. I mean, as a nonprofit, we've tried to be accessible and affordable to everyone at all times. We haven't raised our daycare rates in 5 fiscal years, which we like to shout from the rooftops, because I'll tell you that's not easy to do. Gas prices have gone up, food prices have gone up, rent, electricity, everything's gone up, and we've maintained our rates. So,
well, I'm excited that you guys are franchising, because I
know
it's a wonderful concept, and just the name change alone. That it's Town Square First versus the Adult Day Center.
Yeah,
I think there's just so much pushback from people, in terms of, I'm not a baby, perceiving it at that level?
Yeah, we don't present it to, especially when we give tours or talk to, especially in front of the person that does have the cognitive impairment, we never refer to it as a daycare. We usually just call it a senior center, activity center. Some family members will say to their spouse, oh, it's an activity place, you can go kind of, they do activities that help with your memory. That seems to go over pretty well. We don't usually call it a daycare. It is, but that's not how we present it to others. But yeah, Town Square takes that all out of the equation.
Well, yeah, and it gives them, the way you've set up the rooms, all these different places they can go to. I know there was one in Canada, and they called theirs a health club, and or fitness center type thing, and so. And they're much smaller than what you are, but they set up the designated rooms, and it just had a different feel to it and look as well with that. So
yeah, it's really fun. I mean, honestly, we have just such great performers come in, and we see our participants. We call them participants, not patients. We see them just dancing and laughing, and even if they don't recall exactly what they did when they were there. They leave having had a good day. They leave tired, a good tired. They sleep better. It helps to reduce stress, agitation, promote better sleep. I mean, it's just basically we're trying to bring a little bit of joy into an otherwise really difficult situation.
Wonderful. Well, thank you. Maria, I'm going to go to you next. And if you can let us know if you have been personally touched in your circle of friends or family by dementia or COVID-19.
COVID-19, thankfully, no. And dementia, I've worked with dementia for many years, but just in recent years, I had an aunt who developed vascular dementia as a long-term consequence of having had an aneurysm when she was younger. So she had that through her 60s and passed away in her early 70s. But other than that, fortunately, also in my own personal circle, I haven't had to deal with dementia. It's more been my own clinical interest that's brought me here.
Okay, great. Well, lucky you that you haven't been touched by either. So that's good in a big scale. Why don't you tell us how it's affected your university work and what you're seeing in the community at large in Australia?
Yep, sure. I just wanted to firstly say, Lisa and David, you're both doing such great things, such exciting things. I'm going to be looking you both up online once we get off here. I really love the sort of work that you're doing, and it really, I think one of the things that's happened with this whole COVID-19 pandemic is it's really thrown so many things into stark relief, so we're sort of both seeing the level of isolation that people have been moved into, but that have come from, that were already isolated, and we're having to come up with all these creative solutions to try to manage that. So I think on the one hand, we're seeing people in more desperate situations because they are socially isolated. They're not able to access their usual supports, and also, and all of the negative effects of not being able to have contact with people. But we're also seeing so many services coming up with creative ways to overcome that I think are going to carry through to onward into the future. Our national peak body just has started for Dementia Australia has started a social media campaign called, I've got to get it right, Isolation But Not Isolated, and they're encouraging people to post about their own, creative solutions to overcoming isolation, and sort of spread that kind of good news and creativity in order to help others to reach out to people with dementia in their lives, or either personally or that they work with, which I think is a really a really sort of positive way forward. In terms of how COVID-19, well, it's majorly affected my university work. I'm a lecturer in occupational therapy, and we, like universities worldwide, with very little notice, had to suddenly start delivering all of our courses online. And that's been interesting because even my young people, my students who are used to the online world, I can see now there's after several weeks, a couple of months of doing it, they're all starting to unravel with the social isolation of it, and not being able to come into campus and have physical contact with people is starting to wear on them. We're here in Australia, or most parts of Australia, we're gradually really lifting a lot of the restrictions, but there's still no on-campus study, and that's going to go forward through to the rest of the year as far as we can see. So I think, if it's affecting the young ones so much, the effect of the isolation on older adults would be even more marked, because if any of you have young adult children, or you'll know that a lot of their world is online. They're used to online living. So if they're feeling that loss of contact, then those parts of our population who aren't used to being online would be feeling it even more so. And as Laurie would know, my research work and one of my interests over the last few years has been in the area of travel for people with dementia. I've been working on some projects trying to facilitate access to travel. And at the beginning of the year, I got a small grant to do some work looking at, I've been focusing specifically on air travel, but I got a small grant to look at just the travel industry more generally, and how we could facilitate developing positive travel experiences in Australia for people with dementia. And we, at the beginning of March, the contract came through, and we had to sort of say, well, I think we're going to have to delay this now, because we were looking at a travel industry that is completely ground to a halt, and I'm not going to be interested in talking about one sort of subset, and also people with dementia who the last thing they were thinking about is travel at that time, because not just because of the restrictions, but because of the fact that they're a vulnerable population, and that they were hunkering down themselves. So I'm really not sure how things are going to move in that sphere as we come out of the whole pandemic. We may start, we haven't started seeing travel happening within our own country yet, and certainly international travel is way, way down the track. So it's going to be a whole new world, I think, in terms of travel, and whether people living with dementia are going to be ready to sort of dip their toes in that anytime soon. I said to someone that I'm sort of having a bit of an existential crisis about my whole area of research, because it's such an unknown at the moment. So that's one area that I'm sort of just keeping tabs on, I guess. And I guess the other thing that I've been watching with interest in Australia is also our whole situation in residential care or nursing homes, because I think, as in probably just about everywhere else around the world, because they're such a vulnerable population, there was a lot of places initially went into complete lockdown, and I've been so concerned about what was happening inside those homes with the people, the residents with dementia, and were they getting the care that they needed? Because there was initially, by complete lockdown, that meant like no outside visitors at all. There were a lot of places that weren't letting in extra contracted carers or allied health. They weren't letting in anybody outside of their own facility, and that was becoming very distressing for me, just thinking about how life was going for those people. And there's started to be a conversation now about the need for all residents in nursing homes, but and particularly people with dementia, the need for that social contact. And they just released some national guidelines about accepting visitors in in nursing homes, and it was contributed by a number of bodies, and basically taking a human rights approach and sort of saying, well, that they need to be allowed access to visitors, and it's more about, okay, let's talk about how we can make it safe for visitors to come in and have contact, and if they can't physically come in, what are the alternative options? So you're talking about things like using Zoom or window visits or outdoor visits, if not indoor visits. So, and we actually, I mean, the situation, people were becoming so concerned about it that our Prime Minister actually sort of basically addressed nursing homes and said, look, you know, you need to start thinking about taking visitors again. So that's kind of where that national conversation is. But I mean, and in amongst that conversation, we have had two clusters that have been related to nursing homes, and we've just had another. There's a nursing home that's being watched very carefully in the north of our state because a visiting staff member was diagnosed with COVID-19, so they've put into place some, social distancing measures fairly immediately in that place. So there's still always that concern about the vulnerability in those settings. Yeah, well, I think I've talked myself out there.
Have they addressed anything in terms of funds? Because I was just reading a report, I can't remember if it was one of the McKnight reports or not, and just the headline said, one COVID in a nursing home or assisted living triples their cost of functioning. And it's like, they're all hanging on by a shoestring as it is, and then to think of these costs being tripled without something in play. And that seems to be one of the push and pulls here in the States is, they're still fighting to get the PPE, and then they're fighting to get staff, and on top of that.
Interestingly, no, there's been very little conversation about that. And you're right, our aged care facilities have very, so hanging on by a shoestring, so to speak, and there's a lot of, most places have got not the bare minimum, but there's been a lot of conversation in recent years about, staffing levels within aged care, and actually we're in the middle. It's quite interesting. We've been in the middle of a royal commission into aged care at the moment. I don't know quite what's happening to it. I'm presuming it's on hiatus, and that's one of the issues that it's been investigating is the staffing ratios, but there has been very little attention actually paid to that, funding to aged care and the costs of these extra care requirements. And that's one of the things that was why I has kept me awake at night, and to a certain extent, because we also know that people living with dementia, they require extra care, and one of the things that was highlighted was that often a lot of there were a lot of volunteers and visitors coming in, or family members who are kind of providing that extra care for these residents, and they weren't able to get that access through the lockdowns. So I'm just I'm going to be watching this space quite carefully to sort of see how people emerge out of the whole process, in terms of where how are these residents with dementia, I'm worried that they're absolutely going to deteriorate over this time if they're not getting the extra stimulation and care and attention that they really require.
You had mentioned, like with your students, that okay, 2 months is enough. It's building up. Back to normal. And what we're seeing here in the States is, some memory cares are saying we're not going to isolate them in their rooms because they're not going to stay because they don't understand. And then others are really trying very hard to do that. And so there's all different kinds of approaches, but we've had some significant breakouts here in many of our care communities. And what I keep hearing is still there's not enough PPE. We don't have a place to be able to isolate these. We need more funding to be able to take care of this. Lisa, what have you heard? Because you're in the thick of things in terms of administration and trying to juggle the balls and figure all this stuff out too here in the US.
I was just going to chime in actually on the wearing of masks. That's one of the other things, if this is what you're asking, that's one of the other considerations that we have to make is, can our participants that come, of those 25%, can they keep a mask on, right? Staff can, obviously, but first of all, that can be kind of scary if the person doesn't understand why everyone's walking around with masks in front of them. That's number one. But it's simple to have administratively, it's simple to have our staff wear the masks, of course, but to have participants with dementia wear a mask for 8 hours, we're going to try. We're going to try. We're going to require that. That's on the table. But I don't know how that's going to go. I don't know how it's going to go.
Well, and yes, they have to eat and drink and stuff.
They have to eat and drink, so it'll be off and on, off and on. Yeah, I mean, it's crazy. We're going to have to figure that out. We're going to be as safe as we possibly can be. We're going to try to require that. How that plays out, we just can't be sure. If they take it off and they won't put it back on, do we need to ask them to leave? Probably. I mean, that's just...
It's really hard. I've heard some people say that they would prefer the screens, the clear screens, because again, people with dementia rely on facial expressions and nonverbals. I had somebody on from the Netherlands, and they said they're doing like big photos, like 5x6 photos at least in size, and they're being pinned to their uniform so somebody can look at a photo. But again, it's with dementia, is that going to connect to that's who's behind the mask?
Yeah,
that's a whole nother thing.
I was talking to this is outside of work, but I was talking to a guy the other day, had a baseball hat, sunglasses, and a mask, right? I mean, if I had to swear on my children's life to recognize that guy again, I couldn't. I mean, he was completely covered up. So, I mean, not that our staff's going to have sunglasses or a baseball hat, but you get my point. I mean, you cover this up, and you're right, all that facial expression and smiling and, the expression of it's okay, come on, it's gone. So this is an interesting time. So.
Yeah. Well, and people without dementia are struggling, and like I've had friends go,
I don't like keeping it on,
or they're in the store and they're smiling towards somebody, and then they're like, oh, they don't know I'm smiling. How would they
don't? I know.
And so then they've decided they have to, give them a thumbs up or add something to.
And then it fogs up your glasses. So if you're a person also with dementia and glasses, and it's fogging your glasses, that's going to be distressing. So, I mean, we're going to do the absolute best that we possibly can to keep everybody safe, but it will be very interesting to see how this goes. I can imagine that other daycare centers around here are going to have to do the same thing. I mean, so.
It's almost like you need an extension to push your glasses out a little bit.
Put them out, I know. Have you seen the masks? Have you seen the masks that actually look like your own face? Have you seen those?
I haven't seen those. I've seen fake smiles and different things.
Yeah, there's the fake stuff, but ones that actually look like you. That's a picture of you, your mouth on a mask.
Oh, I haven't seen those.
I mean, it's bizarre, but everything is bizarre right now, so I don't know.
Yeah. Crabby me or happy me?
Yeah, I mean, I don't, yeah.
Maria, what are you seeing over there regarding masks?
Well, that's an interesting question because we haven't gone to the universal wearing of masks here. So when we go out in public, we're not required to wear masks, and it's mostly in clinical situations where there's that sort of higher risk, and it's mostly obviously if someone is infectious and they're around other people. But it's mostly within, the healthcare professionals who are treating and working with within the healthcare environment that are using and requiring masks. Some people do choose to wear masks when they're out in public, so there are some people who do wear them. So I haven't personally experienced wearing a mask yet, and I'm hoping I don't have to. But yeah, so we've had a slightly different, I guess, public health approach to it. But having said that, we're a much less populous country. Our population density is much lower, even in our major cities. So it's a little bit easier, and you know, and with the lockdowns, there's hardly anybody about, so it's a little bit easier to maintain the social distancing. But what I was also going to add in about the whole conversation about masks, you've even just, you know, anyone older who's hard of hearing is going to really struggle. So if you're hard of hearing and you've got dementia, and then if you've got the foggy glasses, then you know that's a multitude of sensory input that's not coming in, that's going to make the whole situation quite tricky, I would imagine. And another issue that I thought of in terms of that one of the issues that's been of concern in the nursing homes as well as the whole PPE issue is, and I'm sure it's a similar problem in nursing homes everywhere, is that a lot of the staff are casual workers. So if they don't come into work, they don't get paid, and they're low paid anyway. And so what has been a big issue, is that people have been going to work with symptoms and then later discovered to have COVID-19, and that's what started the few clusters that we've had within nursing homes has been for that exact reason.
Yeah, it's just a push and shove battle back and forth, you know, this push and pull. And we keep learning more things about different types of symptoms and things too, which makes it much more complicated. Well, I want to respect everybody's time here. I think this has been a really interesting conversation. So I'm just going to go to each one of you and ask if you have anything else that you'd like to add. Dave, I'm going to go ahead and start with you.
Thanks, Lori. Yeah, I'll touch back on something that we talked about earlier, and that is the nature of virtual connections as we go forward. You know, we had some discussion about many people are just not familiar with the technology, and that's fair. But if you think about a longer time horizon, you know, maybe decades, younger people who grew up with technology, some call them digital natives, they will become more familiar with this technology. It seems like every year, us oldsters are getting more familiar with it too. So I think the virtualization of the connections will hopefully get better over time, although it's a difficult situation right now.
Okay, great. And then for people to get a hold of you, contact information would you like them to have, Dave?
Simple memorycafedirectory.com is the website. Info, like information, info@memorycafedirectory.com is the email. And I've out there on Facebook, Twitter, and Instagram. So feel free to reach out any way you like.
Wonderful. And then again, for those of you interested in the memory cafes, there are some that are virtual. You go to the Cafe Connect area on the Memory Cafe Directory site, and you know, you can attend those no matter where you live in the world, which is wonderful.
Please do. And if you operate a memory cafe, and certainly if it's a virtual one, submit it. I would love to get it loaded up. There's no charge to use the directory. And shameless plug, watch June 1st for the new calendar format on Cafe Connect. It'll be a lot easier to use.
Wonderful. Thank you. And Lisa, anything else that you would like to add?
Also, sort of follow on the footsteps of Dave here. I mean, seeking out virtual help. I mean, thank goodness we have it, right? Thank goodness we have it. So if daycare centers are closed or in-person support groups, seek out the virtual support. That's what I would say to caregivers, because it is out there, and don't be intimidated by it, because you're right. I mean, young people can do this in their sleep, but one thing that has happened that I've noticed is a lot of our families at first, they're like, oh, I'm not taking blood pressure. I'm not entering it into a smartphone. I don't even have a smartphone, you know. But now, I mean, we walk them through it and now they're great with it. So that's kind of a silver lining. But for me, you know, for my shameless plug would be, you know, if you do need help at home and you're caring for someone with dementia, please, you know, give us a call to learn more about GLENNERCARE. It's covered by Medicare Part B. If you aren't enrolled in Medicare Part B, it's very, very reasonably priced, and you can have just help, peace of mind, support at your fingertips, even though other things in public are closed. It's there for you, and it's operating right now.
So email would be glennercare@glenner.org, and Glenner has 2 N's in it. And then the website, of course, is glenner.org.
Glenner.org, and then you can see all our services, and you would just drop down to the GLENNERCARE page.
Wonderful. Thank you so much for joining us.
Thank you.
Appreciate your time. And Maria, how about you? Anything else that you want to add to the conversation?
I just wanted to say that I think it's really exciting, the innovations that we've all been making online in response to this pandemic. I think it's pushed people to really become creative, and I hope that a lot of those innovations will continue. But I'd also really hope that we don't lose sight of the importance of face-to-face contact and human touch in amongst all of that, that we don't give up on the importance of those areas for any age, because I don't want my students to have to stay online, that's for sure, and I don't want older people and people living with dementia to lose that essential part of their lives.
I think that's a great point. I mean, even I have a granddaughter who's 5, and she's not going to her preschool right now. And her mom's kind of going back and forth of, because they're paying to hold her spot, but they're not sending her because she happens to have asthma really bad. And she's like, she really wants to go back. She wants to graduate with her class. And, we've had these deep conversations on, can they do a Zoom? But I don't think they really want to do a Zoom, because then maybe more people might pull out and stuff. But it's, she misses her little friend. So everybody at every age, this is affecting. And then we have to figure out different ways, to make that, to still meet that need. And, like you said, there are a lot of creative things that are happening out there that are really very, very cool. And I think they're just going to keep coming. And all these virtual and social distancing things are great. But I have heard from so many people, I just want to hug a friend, or I want to hold somebody's hand, or I just want to sit next to them and just kind of be able to breathe in and go, we're back to normal, have some sense of normality and feel safe and in control. And it's thrown us all for a loop. But I think through tough times, good things do come, and we will find them. And I think it's really pushing that envelope of creativity to the forefront as well, which I think is so badly needed, that we don't all get kind of stuck in the mud doing the same things the same way as we've always done, because everything can always be improved. So Maria, are you comfortable giving email address?
Yes, certainly. I realised that when I introduced myself, I didn't let everyone know where I actually work, which is at CQ University in Australia. And so my email address is m.o'reilly, OREILLY, at cqu.edu.au.
Wonderful. Well, thank you all for your time and your commitment to improving the lives of people dealing with dementia, those that serve, those that are diagnosed, and those that are supporting. You're all really making a great difference. And I'm so thankful that you were willing to share what you're doing, because I think that's the way we empower people, is to just have honest conversations of the good, the bad, and the ugly, what's working and what's not. And I think it's inspiring for people to be able to hear voices around the world. So in wrapping up, I just want to thank all of our panelists as well as our listeners here. I hope you found this a valuable conversation. I know that I surely did. And please feel free to like, click, and share. And if you have any questions, you can go to alzheimerspeaks.com. Stay safe, stay healthy, and we'll talk soon. Bye now.